Hi, I'm Ileana and I'm going to be your nurse today. I know you are going to be starting dialysis treatment soon, so I wanted to take a few minutes to talk with you about hemodialysis, what it is, how it works, and what to expect. First, we need to start with the basics. Hemodialysis is a treatment we use when your kidneys aren't able to filter your blood the way they should. It's actually considered the primary treatment for kidney failure. Think of it as an artificial kidney that helps clean your blood when your body can't do it on its own anymore. During hemodialysis, your blood is taken out through a special access point, either from a fistula, graft, or catheter. It then flows through a machine called a dialyzer, which acts like a bundle of capillary tubes with semi-permeable membranes. It is like a collection of tiny filters for your blood. While your blood flows through the dialyzer, it's surrounded by a fluid that's called dialysate. This fluid pulls out waste products, extra fluids, and toxins from your blood using natural processes like diffusion, osmosis, and ultrafiltration. It is pressure-driven, size-based filtration. Using concentration gradients, dialysis allows for the exchange of solutes and water from the blood. In simpler terms, the solutes in the dialysate fluid work to pull the waste away from your blood into the fluid. This is how we balance your electrolytes, fluids, and blood pressure, which are all things your kidney would normally handle. The waste that comes out during dialysis actually has a lot of the same composition and qualities as urine because it's removing the same waste your kidney would usually get rid of. Now, I know dialysis can sound intimidating, but it can be done in different settings like in the hospital, at a dialysis clinic, or even at home in some cases. Most people start with an in clinic treatment. Sometimes during dialysis, we also use it to infuse medications or blood products like red blood cells more safely and quickly. Overall, hemodialysis is an incredibly important and life sustaining treatment for end stage renal disease. There are several lifestyle changes that come with dialysis treatment. To begin, diet becomes increasingly important for patients on hemodialysis. It is common to restrict the amount of protein you eat to minimize the nitrogenous wastes in your blood. It is also recommended to increase your caloric intake with plant based carbohydrates and fats. Additionally, fluid and sodium restrictions are another important component of diet for patients on dialysis. Most patients are put on 1 to 1.5 liter per day restrictions for fluids. Sour candies, frozen fruit, frequent oral care, and other saliva stimulants are recommended to decrease the discomfort that often comes with thirst and dry mouth. An individualized diet plan will be implemented depending on the stage of your renal disease and your labs. Labs are drawn very frequently for dialysis patients. Dialysis is often 3 times a week, and labs are regularly drawn before and after to ensure effective treatment. Finally, increased physical activity and smoking cessation are important lifestyle modifications for more positive patient outcomes. Although these changes may be hard to adjust to, just know we are here for you to support you throughout this transition. Do you have any questions or worries that I can help answer?